I'm a urologist and I take care of penises for a living. And sadly, sometimes people unintentionally do things that harm this very important organ. Today, that changes. I'm Dr. Rena Malik, urologist and pelvic surgeon, and I'm gonna walk you through the things you should absolutely never do to your penis. Some of these will genuinely surprise you, and at least a few of them are things you're probably doing already. So by the end of this video, you're gonna understand not just what to stop, but why it could cause problems. First off, your penis is not just for sex. While probably what you think about most when it comes to your genitals is sex, there's much more to it. Your penis is a biomarker of your overall health. The blood vessels that supply your erections are among the smallest anywhere in the body, about 1 to 2 millimeters wide. By comparison, your arteries to your heart are 3 to 4 millimeters, so basically double the size. So when something starts going wrong in your body, like high blood pressure, blood sugar changes, chronic inflammation, damage from smoking, those vessels take the hit first because they're the smallest ones we've got. Because of this, guys actually see problems with erections about 2 to 5 years before they have a major cardiovascular event. Think heart attack, stroke, anything like that. And men with ED or problems with erections carry nearly a 50% greater risk of heart disease compared to guys without it. So we want to keep this organ completely healthy at all times, not just because we want to have great erections, but because it helps our overall health. And I talk about this all in my new book called The Hard Truth. If you guys want to learn the foundational pillars for what you need to do to maintain your health, and it's not just diet and exercise, there's so much more to it, check out my book called The Hard Truth. You can pre-order it right now at renamalikmd.com/hardtruth and get over $600 of pre-order bonuses. Number one, not exercising enough. Of course, you've heard this over and over again, but there's data behind it. A meta-analysis pulled data from 11 randomized controlled trials that covered over 1,100 men and found that regular aerobic exercise shows significant improvements in erectile function. Specifically, when you do about 150 to 160 minutes, it improves your erections as good as Viagra. And guys who have the most severe dysfunction saw the greatest benefit, nearly double the improvement of guys who have milder dysfunction. What I tell my patients is move your body. Just start really, really small, 5 to 10 minutes maybe of a walk a day, and increase it until you're getting to the point where you're doing moderately intense aerobic activity for at least 30 minutes 5 times a week. Guys, I know it seems like a lot, but just start small wherever you can. It doesn't need to be dramatic. Start with something so simple you can't ignore. Even like just putting on your sneakers can be your step one. That's all you do for the day is put on your sneakers and then take them off. As soon as you get into the habit of doing these things, it becomes a lot easier. As you guys know, I've been recovering from surgery and I've been missing the gym so much. It's just such a part of my life that like when I can't go, I feel sad about it. Number two is trying DIY methods to enhance your organ. If you're doing something that is not genuinely made for your penis, don't use it. And if you found it on Reddit, think twice. I can't tell you the number of times I've seen patients come into the hospital in the emergency room because they were doing something that they thought was a good idea. Either they were drunk, they were high, they were under some sort of substance and thought this is going to be great. I'm going to make my penis bigger. It's going to look great. And they've actually ended up hurting themselves. A big one that I see is people will put something on the penis to use as like a constriction band, which you can buy that are safe, that are easy to come off. You can buy silicone that are like rings that kind of go on and then you can take them off easily. They're stretchy, they're safe, but they decide, hey, I really want to have sex tonight and I don't have anything else, so I'm just going to take whatever I can find in my house and put it on my penis. Bad idea, because what happens is that doesn't stretch, right? And so when you put it on, the penis slowly starts swelling in front of it. And so it gets swollen and you can't get it off. And if you leave that on too long, say you pass out drunk and you left it on for a day, that tissue starts not getting any blood flow. And then you start getting really permanent problems to your penis. So please don't do that. Don't do anything that is not made for your penis. And if you buy something for your penis, follow the instructions as they are. Don't do more than what it says. I know you guys are my patients, you guys are my people. You want to be the best you can be at anything you do. And so when you see something that says do it 3 times a day, you're gonna do it 4 times a day. It says 5 minutes, you're gonna do 10 minutes. No, do exactly what it says, follow the instructions. Number 3 is smoking. Guys, smoking is not sexy. Nicotine and tobacco compounds, they damage the endothelium or the inner lining of your blood vessels, including those blood vessels that go to your penis. A study that looked at 6,000 men who were current smokers found that they had significantly lower libido or sex drive and higher rates of erectile dysfunction than non-smokers and even former smokers. The good news is that research shows that even if you stop smoking, within 24 to 36 hours, you see improvements in penile blood flow right away. So within a day and a half, your body starts to repair itself. Smoking also causes bladder cancer. It's a leading preventable cause of bladder cancer, and I see this regularly. So please, if you need one more reason to stop, this is it. Number 4 is sleeping too little. Guys, I'm guilty of it too, but research has found consistent associations between regularly sleeping fewer than 7 hours a night and higher rates of erectile dysfunction, low desire, and fertility problems. This is because sleep is when your testosterone regenerates and gets to its highest peak. Your body basically completes all its hormonal cycles and cellular repair, and your sexual health needs that. If you consistently cut your sleep short, your sexual health is going to show. Number 5 is stressing too much. Guys, we are in a society where stress is so normal. Like people are like, what, how could I not be stressed? But you can work on stress reduction and it really makes a difference. There was actually a study that looked at residents in hospitals. These are like young, healthy guys, right? They're in their like late 20s, early 30s. They're all super healthy, and compared them to matching guys who were not working as residents. So residents, if you don't know, are trainees to become doctors. They are doctors, but they're sort of in the training situation. And we worked 80 hours plus. You often had overnight calls, you were low on sleep, probably the hardest you've ever worked in your life. They obviously have very, very high levels of stress. And when you compared their testosterone to other people in the same hospital who worked in less stressful jobs, they had significantly lower testosterone. And that's crazy because these are young, healthy guys. Number 6 is a poor diet. Now, everyone says you are what you eat, but I say your penis is only as hard as your diet is good. A 2020 study from Harvard looked at 3,000 men and found that those who had diets that were really highly processed, had refined grains, high sugar beverages, and fatty snacks had lower sperm count and lower testicular function. So when you have these types of diets, you get more systemic inflammation, you get damage to the blood vessels or vascular damage, metabolic disruptions, and your erections just don't work. Number 7 is a sedentary lifestyle. Now, this is different than actually exercising. This is actually just sitting on your ass. And because if you exercise once a day, but spend the rest of the day on the couch, you're pretty sedentary and it has negative effects on your penis. So in an analysis of 4,000 guys who were sedentary for more than 2 hours a day looking at some sort of screen, they had a 32% increased risk of erectile dysfunction. Guys, you want to scroll your phone? Go for a walk while you're doing it. Or get a standing walking pad so that you can watch TV and walk at the same time. Another study found that healthy guys who watched more than 20 hours of TV per week had sperm counts that were 44% lower than guys who watched very little. Now, the reason for this is when you're sedentary, you're not getting good circulation. You're not having great metabolic health outcomes because you're not really doing anything. You're getting less cardiovascular output, and you need all those things for healthy reproductive function. Your body is meant to move. And if you're having stillness for hours of the day when you're awake, that's not good for your overall health and definitely not good for your sexual health. The other thing is pelvic floor dysfunction can become more likely when you're sitting all day. So during COVID, I saw so many guys come in with erectile dysfunction that all of a sudden came out of nowhere and they were sitting all day taking Zoom meetings. And it's because when you're sitting, you're basically not using your pelvic floor appropriately. It sort of gets stuck in this high tone situation and it's causing less blood flow to the genitals. And that makes it more difficult to get erections. So make sure if you are somebody who has a sitting job and you're sitting all day, you're walking throughout the day. You're doing something to move your body. You are taking breaks intentionally to move, or get a standing desk so the desk goes up and you can stand and create, continue working that way. Number 8, neglecting your teeth. Yes, your teeth. And this is a big one, guys. If you saw my podcast with Dr. Katie Lee, we talked about it, but a 2021 analysis reviewed 19 separate studies and found consistent, significant associations between people who had chronic periodontal disease and erectile dysfunction. Because bacteria from uncontrolled gum disease enter the bloodstream and they trigger this systemic inflammation, so inflammation throughout the body that then damages the blood vessels and then causes problems with blood flow to the penis. So if you floss daily, brush regularly, you're not only making your mouth good, you're also protecting your penis. And and your partner is going to appreciate your dazzling smile. Number 9 is ignoring what your body is trying to tell you. When you notice changes or problems, you have to pay attention. This can be things like changes in your skin that don't go away, ulcers, if you have chronic pain, if you have bleeding anywhere from your penis, from your bottom, anywhere, persistent difficulty with erections, stop ignoring it. Well, most of the time, guys, this is nothing burgers. Usually you're just worried about something and we can reassure you, but sometimes we do catch things early and we can save your life. Number 10 is having dumb sex. Guys, you have to be smart during sex. What does that mean? Have fun, but be smart. Use protection. Protect yourself from STIs and protect yourself from penile fracture. Penile fracture is a real thing that happens when the penis bends forcibly at the wrong angle during sex and causes the outer lining outside the erectile tissue called the tunica albuginea to tear. When this happens, you will typically hear a sound, have immediate pain, and your erection goes away almost instantly, followed by some rapid swelling and bruising. There's not a bone in the penis, right? So you're not actually fracturing a bone, but you're fracturing that outer sheath, that dense fibrous sheath called the tunica albuginea that surrounds the erectile tissue. Now, this is a surgical emergency because if you don't get this repaired, about 50% of guys who have this have long-term complications like erectile dysfunction, permanent curvature, or painful erections. So you have to come into the hospital and get this repaired. So the best way to do this is to be safe. And by doing that, what I mean is stay in control during sex. If you are having vigorous sexual activity, make sure you are always in control of how your partner is maybe on top of you or your partner is doing the motions. Make sure you have some sense of control and it's not all over the place because that's when essentially if the penis slips out of the vagina and bends, that's when we see these fractures. And the last one is something that you might not think about, but not pulling back your foreskin over the head. So for guys who have intact foreskin, when you pull the foreskin back for whatever reason, if you don't put it back, that foreskin actually creates a tissue band. That tissue band can then swell and tighten around the penile tissue and create sort of a tourniquet, meaning that there's now no blood flow getting beyond that tourniquet. Not only painful, but it can also damage the erectile tissue, similar to how I talked about how if you put a constriction band that you don't take off for too long, the same thing, you're not getting blood flow to the tissues. And so always pull your foreskin back over the head. Now, I encourage people who are uncircumcised to pull it back, clean under there, and then always put it back because one, you want to keep good hygiene, otherwise you get infections, and you want to prevent sort of chronic inflammation in that area. Always make sure to put it back. If for some reason, maybe you're a young person, someone's taking care of your father who's uncircumcised and they put a catheter in, you make sure they pull that foreskin back over the top of the head because I've seen it very often in older patients where, someone puts a catheter and forgets to put the foreskin back. Okay, so as someone whose job it is to make sure your penis is healthy, I hope you found this helpful. If you learned something, don't forget to subscribe and share this video with someone who might benefit because guys, we need to start talking about our bodies and our sex lives openly. This is not something to be embarrassed about. This is something that we need to prioritize taking care of. And as always, I'm going to take care of yourself because you are worth it.